We kinda need a revolution. Welcome to the special edition of the Club of Rome podcast, exploring how we can work together across generations to mobilize action for a regenerative future. To get there, we need some systemic change, a revolution of sorts, maybe. I am Nolita Mvunelo, Program Manager for the Club of Rome, and in this episode, we'll be diving into the topic of public health in nature crisis. Joining us today is Saad Uakkas, a Moroccan medical doctor and a youth engagement and empowerment specialist. We're seeing a growing frequency of nature crisis across the world. More recently, the floods in Kenya have resulted in a loss of over 230 lives and 40,000 households displaced. And similarly, in 2022, on the east coast of South Africa, flooding claimed over 300 lives. These events are catastrophic and pose a serious threat to the lives of many, with far reaching impact, tearing away hard won gains in public health and infrastructure. So I turn over to you, Sat. Firstly, thanking you for joining us and also asking you to briefly introduce yourself.
Dr. Saad Uakkas here. I am the executive chair of the African Youth Initiative for Climate Change, which represents and unites African young people all over the continent. I'm also the environment working group of the Global Mental Health Action Network, so working on the intersection of climate change and mental health on the global level. Medical doctor by background, climate actor by passion, and young African from Morocco. So great to be here.
Thank you so much for joining us. So, in January 2024, the World Economic Forum released a report quantifying the impact of climate change on human health, which projects that by 2050, climate change could result in an additional 14.5 million deaths and 1.1 trillion US dollars in extra healthcare costs. With your extensive experience as an MD working with young people on climate change issues, what specific health challenges have you observed that could contribute to such significant impacts in the next few decades?
I already started seeing that when I was a medical student, seeing more respiratory diseases in the city I worked on, Kenitra, which is has a really large industrial part, and that was one example how pollution, both air, water pollution, affected health of the local population. So we have seen that we have seen more people coming with also these infectious diseases. Also, that was something not only in Morocco but all over the continent, in the way that weather patterns change and rains patterns also change. This affects the habitat of vector-borne diseases, and also when the weather is warmer, more insect-borne diseases can spread more easily and for longer periods. So this constitutes a huge threat for us in Africa, especially with all the neglected tropical diseases, with like infectious diseases like malaria, and those insects being able to live longer and in more places. You've been talking about disasters. Recently in Morocco we had a this earthquake, and I remember people in Pakistan, in Libya, with those floodings that they had in UAE, and the houses that are being lost, and the habitats and all those infrastructure. This usually has a direct impact on people's livelihood, on people's food security, and then the thing that I work most on people's mental health. And I can't tell you enough how crucial that is when you lose your house, when you lose your livelihood, your daily life. Here we're talking, for example, about farmers in the rural areas that don't have access to water, to agriculture anymore, so livelihood loss, and they're obliged to migrate to find a new source of income. Those people usually they have a huge mental health consequences out of that, and with psychologists, with mental health professionals, we've been seeing that the need for mental health support for people, because of all the uncertainty, because of all the impacts of climate change, has been immense. And then finally, health systems, and usually here we're talking about for example, the continent, we have hospitals and weak infrastructure, and especially in the rural areas. So the health system is not ready to cope up with the impacts of climate change. So when a disaster happens, resilience is not there. So usually you have a health system which loses electricity, or which loses, people lose access to hospitals because of climate or disaster events. When something related to climate change happens, people really get affected, lose access to basic healthcare services, and it can affect them. Just losing access to medication can really have a huge effect in your life if you're in a rural area. And then, of course, you have food security, with the lack of water, with all the effects on agriculture. Food security is a very, very important one. So impacts of climate change on health, we can talk on a lot of aspects. And one thing is, recently the World Health Assembly that happened in Geneva recognized that, and they voted for a resolution. For the first time, they adopted that in the World Health Assembly related to climate change and public health, recognizing that today climate change is the number one killer, is the number one disease. And as you said, the amount of lives that are threatened because of climate change is huge. So today, this is a very relevant discussion for all of us to be aware of this intersection, and to know what steps we need to take in order to take care of our health, take improve the health system resilience, and prevent climate change in the future.
Thank you for such a comprehensive answer. And it makes me want to ask a very specific question, because you worked as a medical doctor, you have a very specific focus on healthcare, but you also work very closely with young people in working in climate change, and also working on climate resilience, etc. Practically, what interventions have you seen coming from the youth constituencies that you're working with when it comes to this problem of climate related disasters and healthcare?
One concrete example is young people doing the research, being there in the field and getting the data. That's for me step number one. And I've been seeing people in the continent doing that. Many young people now working on the intersection of climate and health. So being there in the ground, doing surveys, trying to identify the issues that are being there in the community. For example, today we have a very good relation and collaboration with the International Federation of Medical Students Association, with the African Youth Public Health Association. So there are health related youth groups with which we are collaborating in order to do such data gathering, such research action. Other actions that people are doing in the ground is how can you improve food systems, how can you talk about agriculture that is more resilience to climate change, and then climate smart agriculture, and also agroecology. So here we're talking about using natural seeds, here we're talking about using agriculture with less water consumption, and then having a holistic ecosystem in which you reduce the use of pesticides, which you have an agriculture which is more sustainable and more kind of healthy in a way, because that's what that allows you is to increase your food quality, and with that you have better healthy and more healthy food for your local populations. And then here where another area is advocacy, and using the health arguments to advocate and to push for policy and decisions to prevent and control climate change. Here, for example, I'm talking of people gathering data about the pollution or the effect of industry, or the effect of greenhouse gases on people's livelihood, and then advocating together using media, joining the voices of health professionals, and trying to push for policies which will improve the situation. And then also having the dialogue with private sector about how can we like prevent these health outcomes, how can we hold them accountable, how can we put pressure on the private sector to reduce their emissions, or figure out ways to also include them in the conversation, so that we can together decrease the health impacts of climate change. So policy action is very important. One very good example, for example, I remember a youth group in Nigeria, Susti Vibes. Yeah, those people are doing great work when it comes to climate change and mental health. One aspect, one specific aspect they have is climate care for activists, for people who are working within the space and who keep seeing the negative impacts of climate change. So, how can you care about yourself as a young person? Because at some points it gets overwhelming when you see that it's bigger than you. We're talking about climate anxiety within the youth generation, and how young people today see that there is so much happening and you can't solve the problem alone. So sometimes they say that it's very important to take a break and to have your support system as a young person, so that you are not consumed. And Sosti Vibes are trying to are trying to provide support system for young activists that are in Nigeria, that are in West African countries, and helping them care for themselves. So climate anxiety and caring about yourself as a person is very important. And this is not only for climate actors, this is for everyone in today's world. We're rushing, we're trying to make something good for the world. So let us all remember to take care of ourselves and also of our lovely ones, and have this support system, because mental health and well-being is what keeps us going, and it's very important to take care of ourselves within this journey. So young people are doing a lot, community action when it comes to also using the health argument, when you come to talking with people, when you are pushing for individual action, for example, recycling or waste management approach within the community, or you're asking people to change the way they live and live in a more sustainable way. You always educate them about the health impact, and how if you are walking, for example, instead of using the car, or biking, or changing your lifestyle to a more sustainable one, it's directly affecting your health impacts. And this is for people, when you are educating them and trying to push for behavior change. You should eat more local food, more vegetables, you should eat more sustainable food, and this directly gives you a healthier diet. If you are having a sustainable lifestyle, more walking, more active lifestyle, you are taking care of your health. And also for the government, we're pushing for smart cities, where you're pushing for clean cities, and then cities that would be with green spaces, with access to walking spaces, where you have access to spaces to also kind of use less cars, and you have better public transport. This directly affects the health of people.
Thank you. That's such a very comprehensive answer, but also it speaks a lot to the systemic nature of the problem. Because you touched on many points, right? On like the way we build our cities is one way that we need to consider. Mental health is an important one, but also with whom we collaborate. We collaborate amongst young people in different sectors and their specialties, but also advocating for change to happen in the private sector, etc. My next question is then, have you seen how collaboration can work well with the public sector also, speaking very much like in the local level, but also maybe in the international level, as you mentioned an example. And I asked this specifically because that public health is also very much a social fabric of society. So there's interventions that can be done at the community and the individual level, but as you mentioned, like the resilience of healthcare systems requires also quite a lot of participation of all parties and planning of all parties. Is there Do you see that there's room for young people to work with different public sector in different countries? And what examples have you seen if that's the case?
The first action that public sector needs to take in order to recognize the intersection is them working together. So here, for example, we're talking about the Ministry of Environment having a climate change department, for example. That's a concrete example in which where public health people can start having this climate reflection and climate discussion and taking the right action. To be uh, honest with you, the intersection between climate and health, I mean, the discussion has been there for a while, but then the concrete actions have started recently. So in the continent, it's still an ongoing conversation. And some practices that I have seen is how can you push for climate education and awareness within the health community. So, for example, as a doctor, I'm aware of health communities that are pushing and advocating for health communities or health ministry and doctors knowing more about climate change. If someone comes to you with, for example, a vector-borne disease, or with someone having malnutrition or something related to air pollution, so how can you deal with it? For example, if you are working in managing a healthcare infrastructure or a healthcare facility on the local level, for example, and then you notice that you have for example, disasters, or you have climate change consequences that are affecting the local population. So what kind of healthcare services should you be able to offer them? How can you deal with that as healthcare facility? How can you ensure the resilience of your healthcare facility? If an earthquake or a flooding happens, so are you taking the right measures to improve your resilience as a healthcare facility? If electricity is lost because of the consequences of climate change, then how can you improve the resilience of your healthcare facility? So those are the dialogues that we need to have with the public sector. And then also the dialogue of that's also on a later stage, to be realistic, is how can you reduce the climate impacts of the healthcare system? It's not the biggest polluter in our countries, but still, how can you make the healthcare system greener? Today in Morocco, for example, we have a green hospital in Marrakesh. They are starting to have this conversation. How can I, for example, have a waste management system for our healthcare facilities? And then finally, we're talking about the population change, and then community engagement, and making sure people live in a healthier way and in a more sustainable way, and it goes together. So how can we have this dialogue where the health ministry, the climate ministry come up with a model of a green, clean, and healthy city, or a space where people can have good infrastructure, where it's access to clean air, access to green infrastructure, access to healthy lifestyle. So this conversation about local, it needs to be local, because it depends from city to city, between region to region. And how can you make your city, your village, green, clean, and healthy, is very important responsibility, very important discussion, and it's a shared responsibility. So public sector, engaging with them, that's first, making them know the importance of the intersection, and recognizing that they need to work on the intersection is step number two. Pushing for concrete policies and then helping them grow the infrastructure is the way forward.
You said it is incredibly local and has to be dealt with in the local, but also it is incredibly personal, because health has to do a lot with how people feel in their personal health, as well as also the infrastructure and the overall arcing availability of resources that there is. So my next question is about intergenerational leadership. So we've spoken about collaboration in different sectors, and even the scopes in which there's a need and an opportunity for transformation. But where has and can intergenerational leadership and learning play a role in accelerating the progress in some of these processes? So on public health and nature crisis. And do you have any examples that you could share with us, please?
Yeah, definitely. Now we talk about intergenerational dialogue and collaboration. And by bringing the young generation into the table, you can tap into their potential, you can tap into their expertise, and go forward, and accelerate the action. Something for climate change, that's just to start the conversation with, is, for example, in Tunisia, they have now the youth negotiators group. and they've been doing that for 2 years, where they bring young people, they train them on climate negotiations, they involve them as young negotiators, negotiating on behalf of the country. And what that allows is bringing the expertise of young people and bringing innovations, new ideas, innovative ideas, new perspective, community perspective. Young people who are leading NGOs, who know what's going on in the ground, they are there in the policy space, leading the discussions behalf of their country. They have a major role. Here we're talking about young people taking those policies and taking them and implementing them in the local level with the communities. When it comes to community education, when it comes to using social media, going to the ground, talking with people, capacity building action that young people can do. So involving young people in the implementation process is key, because they have the energy and they have the expertise in community mobilization. And also one example is how can you push for innovation in the space. This is a very big area where there is a lot of potential and it's not explored yet. So it's having this intergenerational discussion where you bring people from the public and private sector, and you have people, young people, leading the innovation. So you can have hackathons, you can have working sessions where you support the young people to bring you new solutions for the climate and health crisis. So it's either technologies, so it's either indigenous solutions which are brought back and amplified, and figuring out ways that are local and that can solve these issues. And then of course you have intergenerational action when it comes to global policy. And I talked about a little how young people can play a role in diplomacy, how sharing with each other. We today, for example, in the African Youth Initiative for Climate Change, we have young people sharing with each other, reflecting with each other what's going on. We are organizing the regional conference of Youth Africa very soon, so where we are bringing young people with each other. So having that similar intergenerational dialogue on the global level. So with big entities, with actors like the Africa Development Bank, like the African Union, like with the UN agencies, with foundations, and reflecting like what are the realities when it comes to the continental level, on the regional level, what are the opportunities that we have that we can tap on today, and then how can we be involved and support that momentum as young people on the regional level, is also a very important conversation to have, so that you are acting locally but also you are thinking globally at the same time.
Tapping into your expertise, that was something you mentioned as you were answering, and it brings to mind, as I guess the theme of the today's conversation is, it's a systemic problem, it's a complex problem, but if I were to add my 2 cents, is that the thing about having a systems perspective is that you get to see the whole. And so thank you for showing us the whole of the how complex this challenge is. But also the great thing is that you get to be the master of your own fate at the same time, the more you get to see the whole of the problem for what it is. So if you had maybe one last brief point of advice or question someone of any age should ask themselves if they want to get started in working on this particular topic, on public health and nature crisis, what would it be?
Yeah, health and climate are both realities that we should, care about today. Now, as a young person and growing and knowing that in the future, those are the two biggest factors that can affect my life and the life of my children. They need to be healthy, they need to have a good life, and to do that, they need a good health and they need a good environment around them. So it's about recognizing that health and climate are the most important existential conversations for us, this coming generation. So that's one. So knowing basic, how can you take care of your environment on a daily life, and then how can you take care of your health on a daily life, eating healthy, walking, and then because we are very diverse, so from your own space, from your own day, whatever work you are doing, how can I contribute to making our country or my world healthier and cleaner? So that's the question you should ask yourself. If you are an engineer, so how can you, for example, work in a private sector? How can you maybe have this discussion of making my work, less polluting, or, for example, having this discussion about improving the health and well-being of myself and of my community? If you are an architect, if you are a medical doctor or a health professional, how can I have the climate conversation? What can I do about it? If you are working in environment related topic, how can I include the health conversation in the topic? So depending on your work, asking the question, how can I make my world healthier and greener, is very important action. And of course it differs from person to person. You don't have to be an activist or an advocate or be part of an NGO to really dedicate and do this sort of full-time basis. It's the small actions that count. It's knowing that this is important for you. It's knowing what you can do on a personal level, and also it's about contributing to the resilience. This is the real thing. This is the threat that really matters. It's about how can we make our societies more resilient. So we as persons, how can we be more resilient to the risks that are coming to us? How can we improve the infrastructure, the systems that we live in, and make them more resilient to the health impact, to the climate impact, and improve the resilience of our systems? This is the most important discussion that we need to be having, because a lot of consequences are there. And you can do that on a daily basis from your own perspective, and a collaborative approach. What are the systems, what are the networks, what are the groups that are there out there doing action about the specific area that you care about? And how can I join, how can I bring my perspective into the table? And collaborative action is the way forward.
It's about contributing to resilience. Saad Wakas, thank you so much for joining us today and having this lovely discussion. And thank you for listening to the Club of Rome podcast. For more information, please visit clubofrome.org. Thank you.